Hi, everyone. My name is Katie Brumfield. I'm the manager of career services at the Colorado School of Public Health. And today I get the honor to speak with Kathleen. Kathleen is an alum from our school, and she's going to tell us all about her career. Hi, Kathleen.
Hey, good morning.
Good morning. Just a funny story is this is the second time we've done this because both of our Zooms were not working properly last time. So it's going to be even more fun. But I love your career path. I can't wait for you to share everything you do and the amazing public health work you're doing. If you wouldn't mind just introducing yourself, your job title, where you work, and when you graduated and your degree.
Yeah, definitely. Hey everyone, my name is Kathleen McGuire. I'm a health policy analyst with Maryland Medicaid. So I'm speaking to you today from probably slightly less chilly than it is in Colorado, Baltimore, Maryland. Um,
I don't know. I feel like it gets cold there.
It has been very cold the last week or so, but it's finally up above 20 degrees today. So, according to my Denver friends, I think it's warmer here than it is there.
Yeah.
So I'm a CSPH alum. I graduated in 2019 from the CSU campus with a concentration in global health and health disparities. And I also completed a certificate in public health emergency management through the CU Anschutz campus.
Nice, nice. I love those certificates, adding them onto the MPH program. Just a good, like, icing on the cake.
Mhm.
Okay, so let's start off. What inspired you to pursue a career in public health?
Yeah, my undergraduate institution is it's a Catholic school, and so they have like a strong emphasis on social justice in all of the curriculum. So I always kind of like knew that I was interested in health and medicine, but I didn't want to be a clinician. And so I knew that I wanted to do something that was going to be impactful and like make a difference and help people. And I never really quite like knew exactly what public health was until I took a class my senior year of college, and then I just kind of like fell in love with it. And so that was kind of what drew me to public health, and then led me to kind of choose like the global health and health disparities concentration at CSU, so I could kind of like maintain that like social justice approach.
Yeah, I feel like that's such a common like way people find out about public health. They, it's like, and that's really why I'm doing a lot of these videos is to spread the word about the public health career paths because a lot of times we stumble into it or you take a class and you're like, oh, this is exactly like what I've been wanting to do, but I didn't know what to call it.
Right, exactly.
So. All right, let's talk about your job. So, policy work is very popular in public health, and I would say because I've learned about your job before, I would say you have the dream job in policy work. Could you walk us through like your typical tasks or, big projects you work on? Kind of like I know there's no typical day, but what do you do?
Yeah, definitely. Yeah, like I'm a health policy analyst with Maryland Medicaid. And my job is kind of broken up into they're kind of like three main areas. And so right now it's kind of our busy season because the state legislature is in session. So in Maryland, Medicaid sits in the Office of Healthcare Financing.
Yeah.
And so Medicaid and like my team specifically handles changes to like Medicaid policy, and if the state legislature is going to, if they propose a bill that's going to change, that's going to have an impact on Medicaid, if it's going to be, expanding coverage or, like making changes to like prior authorizations of some sort of medication, different things like that, then we do a policy and fiscal analysis of the bill to provide the legislature with information about like what do we think the estimated uptake would be, how many people would be impacted, what the estimated cost would be over the next 5 years, things like that. And so that's one part of the job. And then once a bill is passed, my team is involved in implementing and standing up new benefits. So a good example from a couple years ago, like one of the first big projects that I worked on right after I started my job was the Healthy Babies Equity Act, which was a bill that was passed in the state legislature in 2022, I think, and it allows undocumented immigrant women to access Medicaid during the pregnancy and postpartum period. And so my team is involved in like standing up and implementing that benefit. And so the statute that like the mechanism that allows you to cover these individuals through Medicaid is pretty broad,
Okay.
because typically, since Medicaid is funded through a mix of state and federal dollars, generally there are some restrictions on what you can't services you can and like people that you can and can't like serve or cover. And so typically you're not supposed to cover undocumented immigrants or like non-citizen people with federal dollars. Um, but this statute is like pretty broad and makes, like carves out this exception for pregnancy. And so we made decisions about like, okay, so what's the coverage going to look like? All of the decisions, like the bill just says, like they're going to be eligible for Medicaid. What does that look like? So there are different decisions to make about like how much coverage. Some states that have implemented this have restricted it more to just like prenatal care and like, as soon as the baby has been delivered, maybe you're like a month postpartum, then like the coverage ends and then everything just like transitions to focus on the newborn. And then other states like California and Maryland have made decisions to provide more comprehensive care. So, if you like fall and break your arm and need to go to the hospital to like see the doctor because your arm is broken, Medicaid will cover that just the way they would like your ultrasound.
Yeah.
And so we made decisions about that, about like how much postpartum like how long can we afford to like cover postpartum care
Wow.
based on how many people we expect to like enroll in this benefit, getting all of the systems built up, writing transmittals to providers and like hospitals, engaging with stakeholders to make sure that we're like reaching our various communities, which is especially important whenever you're dealing with like like immigrant
Yeah.
populations, because it's going to be like you need a lot of different stakeholder engagement, and it's a lot of like very diverse groups and different like language capabilities.
Yeah.
And so so that was like a really big project that I worked on. It was kind of like, I mean, it was a really big like example of like a really big project for us, and it was kind of like 2 years. Like we're still kind of like wrapping up final details, even
Okay.
though the benefit went live 6 months after the bill was passed or something like that. So it's been, people have been eligible since July 1st of 2022, I think. But yeah, we're still like, so there's a lot of stuff that happens behind the scenes, and that's
Yeah.
kind of what my team
Okay.
is responsible for. And then like once it's a full grown Medicaid benefit and it's ready to like fly the nest, then we hand it over to other teams to kind of like handle like any sort of like day-to-day issues that might pop
Yeah.
up that could just like happen with any sort of Medicaid
Sure.
program, like somebody has trouble billing, some system is down, something like that. And then like, so these are kind of like other problems that occur with like other types of programs. And so then it's not on like our team doesn't handle those anymore. So yeah.
Wow. Okay, so I have to know, like, did you have experience in this? Like, I feel like it would be a really steep learning curve to learn, like, and sometimes when I read like the policies and stuff like that, I don't totally understand some of the jargon, Like, how did you learn this job?
Yeah, so I really did not have a ton of policy experience
Okay.
before I started this job. I mean, I took like the health policy
Mhm.
class that we're all required to take as part of our MPH.
Yeah.
And I had taken like, I think what helped the most was that I had taken some policy classes through the emergency management certificate. And so there's kind of like an emphasis on policy there, especially because there were a lot of changes that were made to like emergency management policies and like disaster response in the wake of 9/11.
Oh,
And so like that was kind of like a major event that had a lot of policy implications. So it's like kind of a good case study.
yeah, yeah,
And so that was like, so I had some exposure from like that angle and was kind of like it sparked my interest.
yeah.
But I really didn't know much of anything about Medicaid. They like during our interview, they have a question they ask you about, like what key components of the Affordable Care Act and the impact on Maryland. And I'm just like deer in the headlights, like no
Yeah.
idea.
Yeah. Oh my
So
gosh.
it was definitely a steep learning curve. But my boss likes to say a lot, our director says, if you've seen one state Medicaid program, you've seen one state Medicaid program, because since states have a lot of flexibility with what they can do with their own money. So like Medicaid programs vary a lot from state to state. Unlike Medicare, which is, like it's pretty much like universal and like set, since it's it's all like federal funding, so it's a lot more like regimented and it's very similar from state to state.
So basically, if you were to go to another state, you'd have to learn it all over again. Yeah.
Mhm. Yeah,
Very
it's like
cool.
it's one of those things where, like, whenever you start talking about like transferable skills, it's like, well, I've like gotten used to reading about the policy. Do I know anything about Colorado Medicaid? No, I do not.
Yeah.
But at least I've had 3 years of experience of like reading policy and
Yeah,
everything.
exactly.
So,
Yeah. Yeah, and being able to like translate it and
mhm.
educate and answer questions on it and then I'm sure you have to stay up to date with changes that could happen, frequently. Um, I mean, we kind of already touched on this, but how do you collaborate with other professionals? I don't know, are you collaborating with like lawyers or senators or, I mean, how does that all work?
Yeah. So my collaboration is I work with a lot of stakeholders, I would say. So like I have like there are some programs that I work on where I guess like the third part of my job, I got kind of
Oh yeah.
distracted and didn't finish my thought. But like the third part of our job that I focus more on is like administering programs. So typically programs, whenever they're like full grown Medicaid benefits, will go and like they like get handed off to other teams,
Mhm.
but because of various reasons some programs aren't really excuse me, aren't really suitable or require like more like day to day, like they require a much more hands-on approach, or they're kind of like special circumstances. So we have one program that we have an environmental health program for Medicaid kids. And so we have one project that does provides lead abatement services. So if you're
Oh,
Medicaid enrolled or Medicaid eligible, um, with an elevated blood lead level, Medicaid can help cover the cost of like the lead inspection in the home and like abating the lead hazards, like, getting rid of paint, making repairs to the home to like make sure that like lead encapsulation will be safe and maintained and everything like that. And then
cool.
we also offer like a home visiting and case management program for kids who have lead poisoning or moderate to severe asthma. And so that's a program that I kind of like I help to administer day to day, and that involves a lot of collaboration with other state partners. So we
Yeah.
run like the lead abatement program is run in collaboration with environmental health and like our housing department. The Environmental Health Bureau also like helps us to run the home visiting program. So like collaborating with a lot of different stakeholders, and then like some community engagement, talking with the health plans. So like we have 9 managed care organizations that we work with in Maryland. So like communicating with them, I have a call later this afternoon to try to like sort out some billing issues for one of my programs.
Wow.
And we don't do too much collaboration with the state legislature. We mostly just like provide responses to proposed bills. And then like the senior like leadership in my department may go and like testify about bills to provide like, more information and things like that.
Wow. Very cool. Very, very cool. Um, well, we kind of already touched on that one. What are some just like standout, like defining moments that you've had in your career or things that you've been able to be a part of that you're really proud of?
Yeah, I would say like definitely like the Healthy Babies project that I worked on has been really impactful. And it's just, it's one of those moments where like it's not typically I don't engage much with like individual Medicaid participants. Like my job is pretty like high level.
Yeah.
But occasionally we get to hear, kind of like testimonials or like stories about, like the impact that our programs have had. So we had one woman who was able to she got Medicaid during her pregnancy through this benefit, and she had cataracts and was like, because she didn't have health insurance, she wasn't able to get cataract surgery before. And it's like a really easy, simple procedure. My mom recently
Yeah.
had it done, and it's like, like a quick in and out, like in our dinky little rural hospital that doesn't like if you have a broken bone, you have to drive 30 minutes to another town. Um, but they can like do her cataract surgery there. So it's like super easy and accessible. But if you don't get it or if you don't have health insurance, then like the cataracts can leave you completely blind. And so through this program, she was able to get health insurance and was able to get her cataracts removed. And it's like this project that I was part of just like gave this woman her whole life back. Like she was like, in like her mid 30s probably and like completely like totally blind until she was able to get health insurance through this program. So that's like really rewarding. It's just, like there's moments like that that remind you like why you do the work that you do and the impact that you're making. It's really
Yes.
rewarding.
I think sometimes that's what's hard about public health is because sometimes you are removed from the like community engagement piece and you're working on these, bigger projects that can impact a community that you don't always get to hear those stories. And so that is nice that you get to hear those and really like bring you back to this is what I'm meant to do. This is why I'm doing it. I love that story. That's such a good one. All right, just like some general public health advice. In your opinion, what do you think some of the pressing challenges in public health are today, or things that we should, that could be, I don't know, so something that could come up as a challenge. I mean, there's always challenges in
Right.
jobs, but
Yeah, I would say like one challenge um that has been that we're dealing with right now is just like budget
yeah,
stuff. It's not like, which is probably like, like the eternal song of public health.
yeah,
But it's been kind of a weird couple of years because there was a lot of funding poured into public health during COVID and the public health emergency. And so now that like, things are winding down, the public health emergency is over, like enhanced federal matching, like extra money from the federal government has gone away. And so now we're like, we have all of these. It's just like it's this crazy thing where like I started my job in the spring of 2022 and my boss was saying, like I said over and over again, like we have this exceptionally crazy, amazing, like landmark year. We're standing up $500 million in new Medicaid benefits. And then like 3 years later, and now they're like, we're talking about like there's budget cuts. We're talking about maybe having to like cut some programs. Like there's a $3 billion deficit. And I was just like, what is, it's just like, it's mind-boggling.
yeah.
And definitely, so it's been an interesting experience. It's been kind of like a crazy roller coaster just in the last couple of years. And so that's definitely like been a challenge for us. We're trying to like figure out, again, like, the eternal song of public health, figure out how to do more with less.
Yeah, exactly. And I think it's not even just the last couple of years. I think it's always been kind of like this, of this kind of
Right.
roller coaster of funding. Yeah, it's that is a big, big challenge for sure. And then being able to adapt and adjust and redirect and all of that. What about some big trends or innovations that you're seeing that could help shape the future of public health?
Yeah, so I think one thing that I've been seeing more of, especially when it comes to like to Medicaid, that's been really interesting, is what we call it's something called in lieu of services. And so it's things like trying to get more towards like the root of social determinants of health or trying to like doing things like food is medicine, providing like additional like funding for like for groceries or like things like that. There are some like California has been implementing some cool things. They're kind of like an innovator when it
Yeah.
comes to to Medicaid programs. And then Maryland is doing we have like a housing and tenancy based case management service for people who are leaving institutional settings. So if you're like leaving incarceration or like a drug treatment facility or something like that, then like this program can help get you like help find you housing. And so Medicaid like can't we can't like pay your mortgage or like pay your rent, but we can like help you to find like help you to access these services. And they're like kind of studying the impact of that as like because like of course like we in public health know that like housing and like all these things can be so directly tied to your health. And so they're looking at the success of the program as like reduction in emergency room visits, which is like a really cool, like interesting proxy.
That is
Um,
cool.
so that's kind of like that's been something I think that has been coming that's like kind of gaining in popularity that I like and I think it's so interesting. So
It
like
is.
I really hope I'm right about that. I really hope that is like
Yeah.
the way that things are going.
I mean, it makes a lot of sense.
Right.
Yeah, no, that I think that's super cool. Thank you for sharing that. Some general career advice. What skills do you think are most important, or skills that you use that have helped you become successful in your career?
Yeah, so I would say like research and like like we're all really good at that after going through like the MPH program and like learning how to like read like technical or academic documents and like try to like understanding like being able to like digest them and write about them is stuff and like understand their impact is definitely important and useful. And then like kind of the other side of that coin, especially with Medicaid, is being able to share that in kind of like a simplified way, because we typically in Medicaid we try to keep things at like a fifth grade reading level for the communications and stuff that we
Yeah.
write. So then it's like, okay, well you have to on one hand you have to be able to read these complicated policies and like write something that's very jargon filled and like official for
Mhm.
like your fellow government peers or like for the Secretary of Health or something like that. And then you also need to be able to write it in a very simple way so that people who are going to be accessing the benefit like understand the
Yeah.
services that they have. So that's definitely something that's really important. And one thing that's been really useful for me that I like did not like a skill that I have gained and it's been really useful that I never thought I would need is like fiscal stuff. I do budgets and like invoices and stuff and I just like I never would have like imagined that that was going to be a part of my career.
Yeah.
So like definitely anything like budgeting or like finance
Mhm.
is
Yeah.
kind of like could be really useful.
Yeah. And that's really in line with what I read about public health jobs and qualifications on job descriptions. It's a lot of communication skills, a lot of budget management skills. So that's good to hear. What about any other like certifications or trainings or anything like that that you would recommend?
Yeah, totally. So there's I've been looking at getting like a project management professional
Yep,
certification.
the
So like
PMP.
that would be something, yeah, PMP would probably be really useful in a lot of different public health fields.
Absolutely.
And especially because I feel like in public health we tend to be pulled in so many directions. Like I think it's very rare that people in public health work in a very siloed
Yeah.
position. So I think it's really useful to be able to like understand how to manage multiple projects, multiple priorities, and like kind of like stay organized and track on things. Which I think we get a lot of that experience just through like going through grad school and being kind of like having to multitask. But I'm kind of like it would be really useful for my job, so I'm looking into that certificate program. And um, yeah, I think like something maybe like grant writing would probably be really useful too. I know there was a class at CSU like through the MPH program, which I didn't end up taking, but would probably be I don't my position doesn't involve any grant writing, but I know that a lot of public health can be grant based. So like that would probably be really useful and like a really good like functional skill.
Absolutely. Yeah. Yeah, 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 definitely. Cool. And then are there any like conferences or journals or professional associations or anything that you follow to stay up to date with what's going on in your job?
Yeah, so I subscribe to I subscribe to a bunch of different newsletters through work. So things like, like the Kaiser Family Foundation, of course, like they have reports on, different like state Medicaid programs. And I subscribe to for health policy, Manat Health is pretty good. They're a law firm, I think in New
Oh,
York. But they do a lot of webinars and stuff
oh, nice.
about health policy and if there are like new laws that are being passed, they'll do a public webinar to like inform people
Good.
about the new law or statute or whatever, which can be really useful because yeah, again, like policy and statute and regulations are still like are kind of like all different things. So it's like it's not necessarily like if you don't have a legal background, which I do not, like sometimes trying to understand sort of like the source of this policy or like, what's like
Mhm.
the law that it's referencing can be really confusing. So that's really useful.
That's very useful. How do you spell that?
Manatt.
Okay. I'm gonna look that up.
Yeah.
That's
And then also like there's a couple of other organizations like I think it's like ASHTO is like the Association of State and Tribal Health
okay.
Officers or something
Yeah,
like
yeah,
that.
yeah.
And I know they put on conferences and stuff. I went to an emergency management conference that they sponsored a couple of years ago. And I think they may do like, they probably do like newsletters and webinars too. And I think like another good one is NASHP, which is like the National Association of Health Policy or something.
Okay, cool. Yeah,
And so like that's a good resource too. And
yeah,
they do like, yeah, so I subscribe to like these newsletters and I go to a lot of like, like webinars and stuff like that, and trainings, and it's all like, and it's really interesting. It's, like a lot of times different state Medicaid, people from different states may like talk about projects. And so that's kind of like that can be a cool way to stay up to
yeah,
date with things that are
yeah.
happening.
Absolutely. Yeah, no, those are great suggestions. All right, so to wrap it up, our last question, what advice would you give to someone that is starting their career in public health or interested in public health and maybe wants to go into policy work?
Yeah, I would say like stay curious and like follow your interest. You would be really surprised like the different once you get it like out into your career, you would be really surprised at the different career paths that people have taken that have led them there. So you would be really surprised like what different types of skills end up coming and interests like end up coming in handy or become relevant. I took that public health emergency management certificate because I was interested. It like and it was I wasn't necessarily like planning on going into emergency management. I didn't really want to be like the emergency management like officer, director person for like a county or something like that. I just like I thought it was really interesting and it ended up being like that policy that was kind of like where I got my policy exposure and was like what I used to like I leveraged to
Yeah,
like in my interview to get my job. And so like I never would have predicted that that particular certificate program or like that first class that I took was gonna like springboard me into a job in Medicaid, and now like I love my job.
yeah,
So I would like don't so I guess like yeah, just like don't feel like too hemmed in by what you think like trying to like make yourself like marketable or like doing what you feel like you're supposed to be
hmm,
doing. Like it's okay to like have kind of like an interest that you follow, have a specific interest. Um, so that
yeah.
would be that's my advice.
No, it's great advice. I mean, so many alums tell me I never thought I'd work in blank, and here I am, and I love it. So
Right.
I think you're totally right. Is like it's the skills you all learn and the skills you all have are just so transferable, and yeah, it's just super cool. Super, super cool. Well, thank you so much for sharing your career path with us, and thank you for all the work you're doing in public health.
Thank you.